So we can think about dividing our clients into two very, very rough categories, and into a category of reluctance, clients who are patients who are willing to do the work, but they're too afraid or ashamed. They kind of know that they're stuck and they don't want to be stuck. They have some insight. They, even though they may have a lot of transference with us, it doesn't get so much in the way of therapy, and they're able to acknowledge their stuck places. This is what I call the reluctant patient, and they're not so difficult to work with because they're bringing it up front, like, I'm stuck here, I want to get unstuck. I know that it's me that's in the way of me, and those are relatively easy to work with.